The Ottawa Hospital is one of the largest hospitals in Canada, and most importantly, it is on the cutting edge of medical education.
Les élèves d'aujourd'hui, les médecins résidents, les étudiants en médecine sont excessivement bien préparés pour débuter leur carrière en tant que médecin.
The Canadian medical training process is internationally regarded as one of the best training processes for doctors in the world. And in fact, many countries look to Canada to guide them in best medical training.
On a accès à des technologies aujourd'hui qui n'existaient même pas il y a quelques années de cela.
The University of Ottawa Skills and Simulation Centre is a very exciting endeavour for both the University of Ottawa and the Ottawa Hospital.
Until the Simulation Centre came along, there really wasn't a good place to learn a new skill except in a very sterile lab or right on a patient.
Now at the Sim Center, the residents are able to practice with our high-fidelity models, and they actually leave the simulated operating theatre thinking it was a real live patient.
At 20,000 square feet, we have different settings for simulation education, including mock operating rooms, mock intensive care units, emergency rooms, and a large area where one can practice different procedures.
This is a Laerdal model. Inside, he has all the structures of a real-life person. So he has his lungs, his heart. You can program your mannequin to have a difficult airway, to make it very difficult for a resident to intubate, so to put the tube down the patient's throat. This gains the confidence of the residents when they're actually able to master a difficult intubation.
Much like the aviation industry, where pilots learn how to fly a plane in a simulator prior to actually taking a plane out, doctors in training now have an opportunity to practice procedures or practice encounters prior to actual exposure to real patients.
We're able to go across the board to many different disciplines, so not just the medical students, not just the residents, not just our faculty, but all of allied health.
For nurses who are wanting to enhance their skills and get better at something, there will be a place that's safe for them to practice.
They can just come over, call me, we'll set up whatever model they want, and they can just do it until they're very confident.
With simulation, we have an opportunity to prepare a doctor better for their eventual practice.
En tant que résidente en chef, j'entends beaucoup de commentaires de mes collègues résidents, de mes collègues étudiants et aussi de mes patrons. Et puis, je pense que le mot d'ordre à l'hôpital d'Ottawa, c'est tout le monde est très heureux. On est exposé à différentes sortes de populations de patients, différentes pathologies, et je pense qu'on sort avec une formation solide.